Hello everyone, my name is Vicky DeRosa and this is All About Health. Today I am with Fatima Covino, who is a psychotherapist, and Kate Thomsen, who is a doctor. I believe it's a functional doctor. Am I?
I'm a family doctor by my conventional training, and I'm also an integrative doctor. So I practice functional medicine,
Okay.
which sort of bridges the worlds of holistic medicine and conventional medicine.
Well, this is a good segue into what do you do exactly?
Okay, so functional medicine is, I love it. It's very scientific based, but it's a medicine that was founded by my mentor by the name of Dr. Jeffrey Bland, and in 1990, I believe, he coined that phrase, functional medicine. And what we believe, and there's many practitioners all over the country of functional medicine now, it's a very active movement. What we believe is that, that basically we believe in biochemical individuality, that every person is different and so they shouldn't be treated the same. It shouldn't be such a thing as cookbook medicine. We believe that we should be treating the person that has the condition, not the disease-specific recipe. So we look at a person and try to see what other things are, do a more physiologic approach to the underpinnings of the disease. And we believe that there's sort of internal and external factors. So like the CDC told us that for most conditions, health conditions, it's 30% genes and 70% lifestyle. So you have to look at people individually and say, how is your lifestyle affecting this condition? And a lot of things that we know right now are that inflammation is a big foundation to a lot of illnesses, cardiovascular disease, osteoporosis, and many of the other chronic diseases. And if you look at what the sources of inflammation in a person's life might be, maybe you could prevent all of those diseases and not just give them a statin drug for high cholesterol. So those are the basic tenets of prevention, that we're trying to look at the root of the disease. What's the cause of the disease? And see if we can help nutritionally with lifestyle and pharmaceutical management if we need to.
Mm-hmm. So in other words, functional medicine is hopefully getting to the individual prior to the onset of the disease, or it can affect, obviously you're saying, after the disease also is diagnosed.
Yeah, it's more of a systems biology approach to both prevention and to management of mostly chronic disease. Because in the current model of healthcare, no one is addressing chronic disease. Surgery really works well for acute disease, and pharmaceutical management, I think, works well for short term. It should be short term.
Give us, for the viewers, give some examples of chronic disease so that they understand what you're talking about.
Chronic diseases are things that are long-lasting, that people have for a long time, like osteoporosis, heart disease, asthma, rheumatoid arthritis, multiple sclerosis, things that have a progressive, unless you intervene, a progressive trajectory to bad health, with usually bad outcomes.
And so those diseases you're suggesting, obviously, 30% genetics, 70% environment. Is that?
Right. I mean, there are diseases. We know that women who have the BRCA genes have a higher incidence of breast cancer. That's a different type of genes. But for most of us, the genomics, or this very small changes on our genes that make you, you, and me, are 30% of what goes on, but your lifestyle sort of washes over those genes and turns them on or turns them off. So you can have a very high genetic risk for cholesterol, for high cholesterol and heart disease in your family, but if you eat a very low saturated fat diet, you don't have that high cholesterol. So it's your lifestyle that determines how your genes are turned on or off for most conditions.
And so how did, you're a family doctor, when did you start getting interested in functional medicine?
Probably always.
Oh, yeah.
Not that it existed then, but my background, I was a teacher first. Actually, it's interesting, my father wanted me to play the organ in a roller skating rink. That was his dream career for me. So I grew up in a time when I didn't really have the confidence to know I could be a scientist. So I was a teacher first, but I got into environmental education, and that's where I really understood the systems biology. I started to look at the web of life, and that really resonated with my values and the way I saw the world. So with that, I wanted to do more environmental work. I got another degree in chemistry to incorporate the sciences, and then somehow got to medical school. It was never on my list of things to do. But I just got attracted to the idea of being able to combine all of that. And medical school was difficult when it's very black and white there, and it was never very black and white in my mind. And of course, I was older when I went to medical school. So I had to look at it in a different way. And when I got out of medical school, I was in the Holistic Medical Students Organization, and then I began to look into this other way of doing it, this integrative approach. And I got my master's in public health and studied women's health mostly, and that's what I do more of, although I have men in my practice too. But women, for the most part, are interested more in prevention and obtaining good health. Men, I don't think they've been accustomed to that idea yet.
Did you guys hear that?
Yeah, well, they're into the quick fix a lot,
Yeah.
And but the men in my practice are very prevention oriented and very interested in how to maintain a healthy lifestyle and how to not get the chronic diseases that they see in their friends, relatives, and family.
So then who would you say is, primarily, do you see people who already have chronic disease and are looking for alternative answers, or do you see people who are healthy and hoping to remain that way?
Both.
Both.
Yeah,
Okay.
both.
And so when, so then if I understand it, and I have Leber's hereditary optic neuropathy. I have not seen you, but I would like to. If I came to you, see, at this point, there is no treatment or cure for the genetic disease that I have. And the only thing it affects is the optic nerve. But say a patient comes to you and has recently been diagnosed with MS or one of the other chronic diseases, you're going to look at that individual patient, and then you will do what? You will do an evaluation based on their body, their lifestyle. What do you do then at that point?
We do a little bit of everything. So I think the first thing is to get a good assessment of how they live their life. So we'll talk about that to some extent. But I like data. I'm a scientist and I like data. So my job is to make the function of their life as healthy as I can, even if I don't know the name of their particular disease. So I just am looking for what are the imbalances in their life. So we can do tests, blood tests, urine tests, and stool tests and saliva tests that look at function. So for example, I want to know the function of your gut, not like a colonoscopy. I want to know what the good bacteria is in there, what the bad bacteria is in there, because it tells me a lot about your immune system. I want to know how your diet is being, what your diet is, but also if it's coming into your body, if it's being digested properly, if it's coming into the blood, if it's getting into the cells, if the cells are utilizing it correctly, and if they're dumping the right byproducts into the urine, then I might be able to say, you know what, you need more magnesium than most people. You need more B12. You have a condition that means that you need more than other people. So just taking a blood level of B12 doesn't tell me if the B12 is working for you or if you need more than other people.
Oh, that's fascinating, right? That's, yeah.
So if you optimize the person's function, then maybe you're going to impact the particular condition that they're inquiring about just because you've improved or made reserve of their other function, of their other tissue function.
So I have to ask, what is your opinion on how much does nutrition affect most people, most diseases?
I did, when I was doing my public health degree, I worked with I won't say her name, but I worked with a doctor. She turned around and she said to me, "Do you really believe you are what you eat?" And I was shocked that a doctor would ask me that, because you know, if you eat too much, you get very heavy, and if you don't eat at all, you die. So obviously, you are what you eat. And the interesting thing about, you know, we used to talk about calories, fat, and protein and carbohydrates as being the most important aspect of how you eat. But what we know now is that food is information to your genes. And the information to your genes is appropriate more so when you're eating natural food, when you're eating the green food and the red food and the orange food, and not Cheetos, not those orange foods. So that when you're eating the packaged food, you know, it's not sending appropriate messages to your DNA. When you're eating high fructose corn syrup, you know, that's laced with mercury now, we find out, you know. That is not giving the appropriate messages to your genes. My mentor, this Dr. Jeff Bland, who's just amazing, calls these things new to nature molecules, and I think that's just a great word. You know, we evolved with the plants, and we evolved with the sun, you know, and so he says that the largest randomized control clinical trial that's ever been done is evolution. That's where we've tested out what's good for us, what's bad for us. And over time, we have evolved to eat the right plants and be out in the sun, and that's what our physiology is meant to function, how it's meant to function well. And in the last 100 years, when things like this packaged food has been developed, and we're sitting in offices all day under fluorescent light, our physiology has been changed so radically in such a short period of time. We think that this chronic disease is because we can't adapt that fast.
And we don't look the same.
No, we don't look the same.
Yeah, it's true.
The metabolic syndrome, we're all big in the middle, you know.
Do you, I have a question for you, Kate. Do you subscribe to a percentage of, let's say, carbohydrates versus proteins versus fats? How do you think ideally nutrition should look so that DNA is optimally functioning in our bodies?
Well, you know, I think that the guidelines are good on that. I think we should be actually probably a little less than 30% fat in our diet. But, and probably people aren't eating as high a quality protein as they should. And then, of course, you know, we have the grain-fed meats that are much better. The grain-fed meats that are a problem, the grass-fed meats, which are much better for you. So even when you talk about the different macronutrients like protein, carbohydrate, and fat, there's distinctions. The distinction I was trying to make is that it's not just the type of food, it's the quality of the food. So within every type of food, you're really looking for the most natural, organic, grass-fed food you can get. Within all those categories.
I hate to do this because this is fascinating. We're going to have to take a break, and we'll be right back in just a couple seconds. Thank you, ladies. We'll be right back. We're back with Fatima and Kate. Welcome again, everyone. I so hated to take a break because it was, I could tell it was going to be, yes, extreme. Please talk some more, Kate. You were just answering Fatima's question about nutrition.
Well, okay, so if you want to know more about, what the appropriate diet maybe for you would be, one of the things that we would do in our office is run a body composition analysis for you. So we would run this bioimpedance. We would put you on on a massage table, and almost like getting an EKG, run a current through you, which runs at different speeds, whether it's going through your skeletal muscle, your fat, your water, whatever. So it's going to then put a picture out for us.
Wait, and what is this called? Body impedance? Bioimpedance analysis.
That's it, an electrical current?
Yeah,
That
yeah,
runs-
you don't feel it. It's like getting an EKG.
Not a shot.
Oh, I see.
No, no. So then we determine what it is you have too much of and what you need more of. So if you don't have enough muscle mass, we'll concentrate more on resistance exercise and protein for you. If you have too much fat, we'll do the same, trying to convert the fat to muscle, because that's the objective.
Like a body mass index kind of thing. Okay.
Body mass indexes doesn't give you the compartments. It does tell you if you're the appropriate weight for the height, but we're interested in the compartments. And even the more fascinating part about this test is that we can look at the water in your body. We can look at the water inside your cells and outside your cells. And so what you want is healthy cells to be like juicy, plump like a grape.
Hydrated.
Hydrated. You don't want them to be, like a raisin. And you don't want a lot of water outside your cells or you'll be puffy,
And so can I interrupt you just for a second? Is this why, and this is going to seem like a silly question, but truly then, if people are healthy on the inside, their skin will always look better. Is that true?
I think that's true.
Yeah.
And we have a picture in our office too of two different people who have the same exact weight, same exact height, and it's sort of the picture breaks down what their insides look like depending on what they're eating. So you can look good on the outside, and some of that is genetic and some of that is just calories, but on the inside you could be very unhealthy if those calories are coming from 5 bananas and 3 Cheetos a day versus green leafies and more other better fruits and vegetables and lots of fiber and grass-fed protein.
Is the converse also true, that you can have maybe breakouts but be doing pretty well on the inside as far as the balance and the nutrients
Yeah, I mean, I
in
think
the body?
the skin really is a good mirror of your health, and so there probably is some imbalance. If there's a breakout in the body, on the face and the skin, then there probably is an imbalance that needs to be looked at, maybe just not an obvious one.
Okay.
But
So then dermatologists really should be looking at the nutrition of
yeah, didn't
children.
Perricone, Dr. Perricone,
Yes.
he's the one who kind of pushed that forward in the media.
Kate, you might find this funny, but if I have an event to go to, 3 or 4 days prior to the event, and if I want to look extra special, 3 or 4 days prior to the event, I will have salmon, blueberries, greens, kale for breakfast, lunch, and dinner.
Wow.
Don't you eat like that all the time?
Well, not for breakfast. The salmon for breakfast is just a special treat.
Yeah.
But it does. It actually just gives you a little. That was good, Fatima. That much, I guess, of the omega-3s gives you just an extra boost of, it just gives you a little bit extra healthier glow. Yeah, yeah.
I think, the skin really loves the good omega fats and the good antioxidants, and that's what, we've been taught. But I think, actually, to your point originally, now that I think about it, there's another imbalance, which is your emotional, spiritual, mental, physical imbalance. So you can be physically healthy and still be having an emotional, crisis, or be too stressed out, or have a
Well, now you're
spiritual
talking right up
crisis.
Fatima's alley.
Yeah.
That's right, yeah. And I liked what you said earlier about not looking at the disease itself, but looking at the symptoms and how the person is doing. And that holistic approach is a very good approach, whether it's physiological, medical, psychological, emotional, mental health.
Do you know, Kate, that I was recently, about a month ago, I was recently interviewed by a reporter, and he did an article. He specifically wanted to speak to one of the physicians that, actually the first physician that diagnosed me with Leber's. And he asked them the question, I am pretty indignant that nutrition has a lot to do with aiding any disease that we have. So obviously I said this to this reporter. He questioned this doctor, and the doctor, and he quoted him in the article, and the doctor said specifically that no, nutrition had nothing to do with any of my recovery of my sight. So there are many physicians out there that do not believe nutrition has anything to do, which obviously you can tell I have an issue with. But
I know people have different philosophies, and everybody's entitled to their philosophy.
Sure.
Actually, we had a therapist in my residency program who said, "Don't worry, you'll get the patients you deserve." So the truth is, you're attracted to who is
Absolutely.
going to be on your same wavelength in terms of your values and your belief systems. And people who come to me are already pre-selected. They've been to my website. They know what I'm about. They come pre-selected. They're ready for the kind of thing that I want to talk about and do for them, help them with. And collaboratively, we do that. But people who go to other doctors who don't believe in nutrition and hand out antibiotics and all, that's another way of doing it. That's just fine,
And their prognosis is also contingent on motivation. So they're highly motivated. By the time they get to you, they've sought you out. They're looking for a very particular type of treatment or intervention, and they wind up on your doorstep, and they're
it makes
the
it
best
much
patient.
easier.
Yeah.
It makes it much easier. I don't have to convince anybody. So I think, I think it did at some point, I read that it actually meant in Greek educator.
it does.
It's not healer. Really you're just a purveyor of information for people so that people can make their own judgments about how to lead a healthy life. Or we are also the keepers of the prescriptions. So we do have that we can do, or the surgeries or something. But really, we're supposed to be about educating people to make choices for themselves so that they can prevent diseases, and they can live a healthy life, or they can, make choices about their disease management. And
do you think, though, Kate, that there's been a paradigm shift lately, maybe the past 20 years, about medicine, in terms of medicine? You're saying that maybe the new perspective is to have a holistic and comprehensive approach to treatment and also preventative medicine, compared to when our parents were growing up and they went to the doctor for that pill or that shot. So it's a very different mindset. Do you feel that there's been that kind of a shift in looking at our health and the way that we treat ourselves as well?
I think it's definitely coming, and I think it's being driven by the consumer who knows that health is more than just taking a pill or having a surgery, and knows that chronic disease is on the rise, and they see, cancer is everywhere. So people are trying to take an active role. So they're the ones that are driving it. Medicine is, conventional medicine is having a little more collaboration with physical medicines like physical therapy and chiropractic, and collaboration with each other. But there's also this other movement that I'm in that I think is also growing in popularity, which is change the whole thing, change it all, let's really focus not on disease management, but it's not that profitable. The profits are in doing surgeries and selling pharmaceuticals, and so prevention doesn't get a lot of reimbursement.
That's right.
I can't write, that the person came into my office. I can't write a code for I want to prevent these diseases and have it get paid for by the insurance company. And yet that would be the cheapest way to do medicine in the long run. So it's an ongoing progression, but I think we are moving in that direction.
Yeah, it's a very exciting time to be in this profession, in medicine and mental health. You have a more educated patient, a more educated consumer, so it's it's nice. It's
Mhm.
nice to work with that.
Mm-hmm.
I have a question. How do you deal with when there's conflict of interest, or when you're working with a patient who also sees another type of physician and you have to work collaboratively? How do you reconcile yourself with those types of conflicts that we just talked about?
Yeah. You know, unfortunately, it would be a really nice world if we could all just get on the phone and talk to each other or email each other and say, you know, this and that, and this is what I'm doing, this is what you're doing. But time being what it is, everybody's really very, very busy. So, you know, I will provide the patient with all the materials that I think that they need, that they can talk to their physician about. But ultimately, it's the patient who has to decide, and it may be just a belief system. Mm-hmm. It may be that if they're more interested, I mean, I don't really believe in a whole lot of right and wrongs. Mm-hmm. You know, I mean, if their belief system is more geared to the way I'm practicing medicine with them, then they're likely to get better doing what we're doing together versus, you know, I always tell people, if it's going to make you anxious to take the pill every morning and say, I really don't like this, I really don't like this, mm-hmm. it's really not doing you any good. Mm-hmm. You know, regardless of what the physiology is, I don't think you can have that conflict. Mm-hmm. So you've got to do what you think. I mean, I think we have moved away from using our intuition mm-hmm. and saying, I feel better when I do things that are in my value system, in my belief system.
Mm-hmm. This is absolutely killing me to do, but we are at the end of our show. This was extremely interesting, mm-hmm. especially for me. So thank you, ladies. Thank you, Fatima. Thank you, Kate. I hope you'll come back and visit again.
Oh, sure.
And if anybody would like to know more about this show or would like to see other topics, please email me at Vicky@studiovhealth.com. Thank you very much. We'll see you next time.